can't sleep at night. I feel sick to my stomach from my own children going through what they're going through, but my patients. And Victoria, I heard a bit earlier you had on the UK, the children there spending so much time in lockdown. But Victoria children, we've done it the hardest. This is the longest lockdown. And for what? It's not doing anything. The virus is still spreading. And you know, where is the second, third, fourth opinions here? As doctors, that's what we do. When we're not winning a race or when we're not getting to the crux of the problem, we go and seek opinions. But we're not told that. There's nothing being let out to the public about any of this. All we're told is to be in lockdown and still be in lockdown. Kids have no hope. So it's actually escalating. I've been quite strong through it all, but I can tell you now it's tearing me apart because day after day, patient after patient I'm seeing, and we have no hope. Like, we're told we might hear something on Sunday. To be honest, it's going to be probably 10 kilometres travel and 3 hours outdoors. There's no hope for the children, and the children need hope. We all need hope, and we don't have it.
Yeah, we can hear how emotional you are and what a toll this is taking.
Yeah,
what are some of the stories that you're hearing from your patients?
Oh, incredible stories of just not, and this is again the same stuff that I'm seeing from last year, but even worse, where very, very happy previous to all of this children that are just sad and bursting into tears, having tantrums, having nightmares, thinking, one little kid saying to their parents, will I ever see my friends again, like in grade 2, like levels at all ages. I can't begin to tell you, and I'm booked up like any GP is now, so much in advance now that, you know, they can't get in to see me. I'm seeing now psychiatry referrals, psychiatrists, and this is across the big major 4 hospitals, Melbourne Clinic and all the other private psychiatry clinics are refusing. They are full. They can't see patients. And these are patients who are suicidal, and all we've got is the public hospital. The public hospital is overflowing. So these pop-up clinics are Band-Aids. They're Band-Aids for a huge bleeding problem here in Victoria, and it's huge. And the Band-Aids are not good enough.
So you're saying the trade-off is not necessarily worth it. I mean, the Victorian government acknowledged today that there has been an increase in emergency department presentations of young people with suicide ideation and self-harm. Were these otherwise normal young people and teenagers, and it's the last 18 months that have taken them to this point?
Absolutely. I can't tell you how many have come in and tried to hurt themselves and tried to suicide and ended up at St Vincent's, at the Austin, at all the public hospitals, Box Hill, and are at huge risk. And they come to us. We're limited. We're drugging these kids because that's, you know, we're so under-resourced, Karina. We are so under-resourced, it's not funny. And the cure is absolutely worse than the disease, in my opinion, because the disease of COVID and how it's been run here is absolutely shocking. It's absolutely shocking. The only thing that the government in Victoria has succeeded in is the longest lockdown in the world. And that's pretty disgusting, in my opinion, because, you know, people are suffering. So is that concern, of all ages.
Is the concern that you have and potentially shared by colleagues of yours, is that message getting relayed back to the state government?
Oh, look, we try, and there's a group of us trying hard, but we're not listened to. We weren't listened to last year. There's no point doing letters because they don't get acknowledged. So all we have is the platform that you're able to give us, and that's it. I mean, you know, meanwhile, we just keep doing the same stuff again, trying to help these kids and adults for that matter. I've had adults in at their wits' end, crying their eyes out, you know, wanting to end their lives. I mean, like, I've never seen anything more crazy in all my life, and all because of lockdown. That's the thing. We're given no hope here. We are being controlled in an absolutely obscene way, and no one's sort of helping us.
Okay, Dr. Stacey Harris, we really appreciate you taking the time to speak to us and to
Thank you
voice
for
your concerns.
having me. Thank you.
And if you need information or support, you can contact Beyond Blue on 1300 22 46 36, or if you or someone you know is experiencing distress, please contact Lifeline on 13 11 14.